Flashes and floaters are visual disturbances that are very common as we age, and a very common reason for people to call in or go and see their ophthalmologist. Floaters are all related to the jelly that's in the back of the eye, which is called the vitreous. Over time, parts of that jelly turn to liquid in places, and those cast different shadows on the retina, which you perceive as floaters. Most people describe floaters as being like a dark spot. I commonly hear it described as like a hair that they just can't swat out of their face, or a bug that they just can't manage to get rid of, and then they realize it's actually in their vision, or kind of looking like a spider web. It's very common to see floaters, especially as you age. However, if these floaters drastically increase in number, such as you typically see a handful, they kind of come and go, they move around, and now all of a sudden you're seeing hundreds, or a really big one that is blocking out a part of your vision, doesn't appear to move around at all, then we would want you to call your ophthalmologist and be evaluated with a dilated eye exam. Flashes of light happen when there's any traction exerted on the retina. This all again comes back to that jelly in the back of the eye. As it turns to liquid in places, it changes how much size and shape it takes up in the back of the eye. As it changes its shape, it shifts around and it starts to separate from a couple places that it's normally tightly attached to in the retina. As it separates, it can cause that traction, and you see that as a flash. And a flash is exactly what it sounds like. It's a very brief, like camera light bulb flash went off in your vision. Sometimes people will just see one, sometimes you can see a handful, and they can increase in number and frequency, which would be a concerning sign that you definitely want to reach out to your ophthalmologist. Flashes and floaters are most common with time, with age. Those liquid spots, some people like to think of as, you get wrinkles on your skin with age. Those are kind of like little wrinkles in the jelly in the back of the eye. So most common with age, but there's a couple other scenarios where we'd want to be especially attentive. People who are really, really nearsighted are at more risk for flashes and floaters, and then those retinal tears and detachments. People who've recently had eye surgery that are experiencing flashes and floaters. Sometimes that can be normal, but good to reach out to your ophthalmologist just to make sure they aren't concerned. And finally, if there is a history of trauma to the eye, even in a long time ago in the past, that could increase risk of those flashes and floaters being signs of something more concerning. Fortunately, most of the time, floaters don't require treatment. While they never actually go away because those liquid spots are still in the back of your eye, your brain does tend to get more used to them over time, so they'll become less bothersome.